Well, thank you. All right. Well, it's about 3 minutes after 10, so we're ready to start. We have Mayor John Cooper on our call today. We very much appreciate you taking the time to do it. I know you're busy. We have several people on the phone that I just should mention on the Zoom call. Councilmember John Rutherford is on. The Comptroller, Justin Wilson, is on. He sent us a letter this week. Thank you, Mr. Comptroller. We have former Attorney General Paul Summers is on the call, and our County Clerk Brenda Wynn is on the call. And if we get some other folks on, I'll mention that. Mr. Mayor, I usually start with a very easy question. Usually it's tell us something unique about yourself, or to a lot of people it's like, tell us who you are, but I'm going to pass on those. I am going to ask you a question. Obviously, this has been a very stressful time for everybody. We understand that. So the easy question for you is, what do you do to try to relax? What do you do to just get some time for yourself?
I have a son, and I have taken up bicycling. And it's been a joy to bicycle around with him. He's fast, and so I don't tend to see him until after we get finished with our rounds. But I would say bicycling has been my COVID pastime.
Okay. All right. Well, I see you out there bicycling, and you've only tried to run me over twice, so that's good. But I understand why on those 2 times why you tried to do it. So anyway, no, I'm glad that you're getting some exercise. I know you walk a lot as well, so good for you. All right. So let's get right to it. The questions that came in, we got lots of questions over the week.
Great.
They basically, I kind of put them into 3 categories: budget, police, and COVID. I will say that the new numbers came in, increase in new cases 268 today, overall 22,714 cases, and 205 deaths. Those are the numbers for today. I'm going to save COVID for the end. So we're going to start with the budget. Okay, because usually when you and I get together, that's what we talk about. And obviously the council passed the budget in June, on June 16th. We had a measure up this past week at the council where we had a council member try to lower the tax rate, or at least get it started, the discussions. And the bill was basically voided from the start because it has to, pursuant to the charter, it has to match up with revenue projections and what we expect in the current fiscal year that we're in now. Depends on the finance director, and so it wasn't going to work. So I think what most people are interested in is, okay, where are we? And maybe you could just start with why, just for people who may not know, why did we need such a high tax rate, or such a high jump in the property tax rate? And it's not a high rate based upon what other cities have, but why did we need this type of property tax increase? And then where are we now? What are we looking at now to kind of see where we go?
Well, thank you, Jim. It's always a treat to be with you, even here in cyberspace. In the last 100 days, we've had 75 press conferences on COVID, so I'm glad to start off with the budget. And let's spend a little bit of time on that, because I think it's a great accomplishment by this council to give us a balanced budget. Now, let's spend a little bit of time on the rate and why and where are we going now. The new tax rate is really a give back of a previous tax cut. Now, even with the increase, we are not going back to what our rate was even 3 years ago. But there was a substantial tax cut 3 years ago that, frankly, the city could not quite afford. And it gamed or hid the fact that it couldn't really afford it by using fake revenue as part of its original strategy. So these would be one-time sales, pretending that that was recurring revenue that the city could spend in the future, and then also raiding reserves. So it made it seem like we had more revenue than we did, but we fundamentally have been in an imbalanced budget over the last several years, and that caught up with us. But that was a solvable problem without raising the tax rate through management and finding additional revenue streams. But what overwhelmed the budget was the fall in city revenues from COVID. Now, to put numbers on this council had to have a budget adjustment of about $570 million. This is an unthinkably large number compared to previous budget years where you might have adjustments ranging from $30 to $75 million. And of the $570 million, in the end, that is paid for by cuts of $250 million in our spending. Actually, cuts, changes, management changes, and also additional revenues. And then the tax increase, which is worth about $330 million. So you have 10 times the amount of budget adjustment in a year than you would normally. You had no cash, you'd already raided the reserves. You had been dealing with an imbalanced budget in the last several years. So you had no margin for error. The city was going to be out of money on July the 1st. Really, and technically a bounce the checks kind of out of money. Given that the fourth quarter of the last fiscal year, with the start of COVID, was, like for businesses and individuals, a massive shock. Ultimately, I agree with the council, felt that pulling back on some of the previous tax cut was the only responsible thing to do. And that we are still the lowest tax city and the lowest tax state in the country. And in no case, I was actually told this yesterday through some of our economic development efforts, there's a lot of interest in people coming to Nashville post-COVID, in businesses and individuals coming to in post-COVID. In no case has anyone viewed our new tax situation as anything other than cheap and advantageous, even with the tax increase. We are still so much lower than other places comparably in terms of the cost that this is not an issue in terms of recruitment. So the why ultimately is you had a imbalanced budget, you'd run out of cash, your revenues were sharply declining, the financial rating and solvency of the city were in question, and the solution is simply to give back some of the tax cut. Now the city is being administered very responsibly, particularly compared to the federal government, which has not had a balanced budget in many years and will not in the future for many years, but they can print money. We cannot print money, and we also can't borrow money. This has been proposed as a suggestion to get ourselves out of getting our financial house back in order, but we have neither of those strategies available. All we can do is actually manage successfully and be true to our commission, which is to leaving a solvent city. All the council members, I'm so grateful to them. Their job is to leave the city better than we found it. And this is a major step. It's very hard politically, but it is a major step in leaving the city better than where we found it. Now, your third question is, where now?
Well, Mr. Mayor, go back for just a second. Let me stop you there, and then I'll go to the future just to answer. So one of the questions that came I thought was interesting, and it was, why do people not understand? I mean, we have to balance our budget. And so I thought one of the questions was interesting. It was talking about the recent people who've been so upset about the increase in the tax rate. But we're under a responsibility to have a balanced budget. You're right, we can't print money. And we understand what COVID has done to us. And so we had to balance out. So you had to find some way to get that thing balanced back. And I think one of the questions was, why do people not understand that? Or why do people still not understand it? And then maybe a second part to it, and obviously we have the comptroller on the call. What did the comptroller's office have to do with this?
Well, a couple of things. This is me. I think um, people are upset in this case because we have become unused to financial responsibility out of any level of government. That's kind of a harsh thing to say, but we are so unused to having a balanced budget, again, particularly at the national level, that it seems shocking that we are having a balanced budget and that we are paying for what we spend. So just think about it. We are so unused in America to paying for what we spend that we could be shocking at the local level that we are doing that. Now, part of that irresponsibility, and that's a tough word, but you can agree or not agree with the spending, but you still have to pay for it, right? And our unwillingness to pay for our spending as a country is going to get us into a profound trouble down the line. Now, we here in Nashville are willing to stand up to the plate and be responsible stewards of the city. That's I think people are upset, not that they're upset, but it's kind of shocking and unusual. And it's so unusual, I think that people can, it manifest itself as upsetness. Now, as for the controller, I am grateful that the state has an umpire who can communicate to citizens complicated financial information as an umpire. I mean, it's one of the reasons I think the controller's office was set up to give citizens that extra level of scrutiny and knowledge that the controller's office provides. It's not everybody's favorite experience to go through, but the likelihood of all counties being managed well all the time, that's not going to happen. You do need supervision. And again, I think that I know he's on the call, but I've certainly said this repeatedly. I think his office has outstanding professionals in it, and we are grateful. We didn't like the message, but there was no disputing its accuracy.
So we just got a letter from the comptroller this week that said, we've approved your budget. Right. So obviously we were glad to receive the letter. I think I read the whole thing yesterday. So we're where we're supposed to be. The comptroller was on this call along with the deputy comptroller, Jason Mumpower. Oh, it's probably been a month or so ago. And he was explaining that he didn't want to take over our checkbook either. That's not right. What they want to do. So obviously we've gotten back to a position where that's not going to happen. He's approved the budget and we are where we are. Okay, so now take us to that last question I had, and that is, tell us, the future. Right. Probably both short term and maybe a little bit longer term. I mean, so, and I'll just kind of set it up. The reason we had this question in the council the other day was that revenues started to look a little bit better than maybe we thought. But again, it's up to the finance director to kind of figure out where we might be in this fiscal year. Right. And people still aren't necessarily comfortable. But then you've got on top of that, the federal government maybe will act, but we don't know. Short term, long term, where are we? Short term, long term. And again, it's in keeping with this being a challenging year. And let me spend some time on the challenges. And it is too early to declare a victory, clearly, either over COVID, the disease, or the effects of COVID financially. Now, it turns out that Q4, to the surprise of almost everybody, was better than we had feared. Well, that, by the way, let's congratulate us on that we prepared for a worse situation and it was better. Now, that's showing responsible management, and that should happen more often, that we were ready for a worse situation than happened. But we don't know if it was a better situation in Q4 because the financial effects of COVID are simply not that great, or that the effects are down the road, and that what really we were counting was the effect of the massive federal stimulus money. And so if the stimulus money disappears, then it's possible that our next fiscal year will be worse.
Now, we all regret having to give some of the tax cut back, and we would like to restore the tax cut. The question is, when is it prudent to do that? So you have to we will have to understand several things: the path of the disease, the actual effect of the disease in terms of permanent damage on our economy, and what our revenue base will be. Are we falsely counting the stimulus money as actually a mitigating effect long-term on COVID? And then is our improved Q4 really just one-time revenue? So can we budget recurring spending on the basis of what ended up being a one-time bonus or blip into our revenue? All these are deep questions that economists, the state of Tennessee, and our finance director are wrestling with every day. And we don't really know the answer. And it starts with this other great unknowable that we'll get to at the end of the conversation, is what is the path of COVID in the community? You know, I mean, without knowing when the Titans can play football to a full stadium, I cannot really tell you with any accuracy what our economic prognosis is going to be as a city for businesses, or for the city as a metro government entity.
Okay. So tell me this, and then we'll get into, maybe this will lead into the question about future. But who do you depend on to help make those economic decisions? I know it's up to the finance director ultimately, but we're in such a weird state right now in this whole thing. We don't know. I mean, I don't know if nobody really knows. Well, but and somebody has to make that call. So who do you depend on?
And for viewers who may not be aware of this, the charter, though unclear in a lot of things, is very clear on something, which is the revenue forecast for the city is 100% under the jurisdiction of the finance director. In the charter, our finance director is sort of a quasi-independent professional entity. We don't have a city manager style of government, but in the charter, the finance director has some aspects of that. And so it is Kevin Crumbo's call completely as to what revenue does the city have to spend and what revenue can we anticipate coming in. It is not overrulable by the council or by the mayor. So when the council confirms the finance director, that's a very important job for the city. And now in Kevin, you do have an extremely qualified individual who is nationally a listed expert in all matters finance, including cities and restructuring. So he is being, I think, an appropriate professional in not getting us into the problem that the city had before, which is spending more money than we had and pretending that we had revenue that we didn't have. And then again, that would have given us a heck of an adjustment this year in all cases, even separate from COVID. But let's not do again the same thing that just got us into trouble, which is to pretend that we have revenue that we in fact never really ended up having.
Okay, so tell me, okay, so take it now, everything stays the same, federal government doesn't do anything, whatever. At some point, and we'll get to COVID, I know, at the end of this thing, but we come out of this thing.
Right. Well, let me, just to interrupt, but I think it's probably good to break this up another way. And this is something I think you're aware of and most council members are aware of and people on the call should be aware of. We did this huge adjustment for this fiscal year, FY21. That does not mean that FY22 is that easy either. And for several of the following reasons, one of which is in funding this year, you did have an enormous contribution from the Music City Center. Once thought impossible, the Music City Center actually contributed $55 million to our budget. That's $55 million that would have otherwise had to come up from layoffs or from additional tax increases. Secondly, as we did not hide, but have alerted people to, we did move $40 million worth of debt service payments on money that we have already committed and borrowed to come from this year into next year. And then also there's an additional $28 million that we are using, frankly, to facilitate some of the federal help into our current budget. All three of those sources of money goes away. So you're starting FY22 with really a $100 million hole. So this is why being a little bit cautious. I mean, we wanted to limit the amount of the tax cut give back that we had to go through in June. But that does not mean that the management challenges going forward are not going to be substantial, because you start out life with this kind of $100 million hole. And I think it's appropriate for me to kind of raise my hand, and for Kevin with the council, and for the Budget and Finance Committee with the council, to not pretend that we don't have these kind of additional challenges that have come through from this, frankly, kind of catastrophic experience that we've had to manage through this last quarter.
Okay. So obviously, it's obviously important to keep an eye on the future, understand what it's going to look like, what are the challenges in terms of budgeting that we need to worry about. But I also think, you know, people on the Zoom call and other people are going like, okay, you know, we want this. We may not ever get back to where we were, but we want businesses open. We want tourists coming back. You know, I hate to say this, but I actually like seeing a pedal tavern for a change. You know, because it means that people are sort of getting back to normal now. We've had to fix some of that stuff, but you know, at some point, hopefully, vaccine, we get back to normal. What do you do? What is your office doing to go, okay, so, you know, we don't like the situation we're in either. How do we start working on trying to get back and make sure that when we finally get back, we haven't lost businesses or as many businesses, that, you know, we're concerned about people paying rent. We're concerned about all that stuff. What is your office doing in terms of that right now?
Well, I mean, the first thing is to get us through the crisis with as little damage as possible. I am thankful for the little bit of federal money that we have, and I'm grateful to the council's committee, this joint CARES committee, to come up with the most effective ways of reducing the crisis on our citizens. I hope that we get some state help, and I hope that we get more federal help in doing that. But in getting through the crisis, the first priority has to be to get through the crisis and to reduce the number of cases so that you can reopen safely as soon as possible. I mean, the fact that we have a school system that is closed and doesn't know when it can reopen safely defines the word crisis when it comes to city government. Now, the economic ramification on the economy, and not just Nashville, is hard to predict, but surely will be wide-ranging. And it will affect probably everything in our lives, as it feels like 10 years of change is happening in just a few months. The future of retail is a question. Now, these are all kind of, you know, important city sectors that we've depended on being healthy for a long period of time. But the future of retail is a question. Downtown office space is ending up as a question. Transportation probably is deeply affected by COVID in some ways. No one quite knows how. So that's all on the downside. On the upside, there does seem to be a wave of interest in cities like Nashville around the country as the national economy repositions itself, with less concentration on the coasts in large, dense urban areas, and more appreciation for the kind of city that we have. So long term, we need to stay invested on a platform that values our neighborhoods and our space and the quality of our lifestyle here, because I do have a feeling that a lot of people will want to be taking advantage of this once we're finally through this cycle. Nobody's moving really right now, but I expect in the year after COVID is over that Nashville will have the biggest year that we ever had.
Okay. All right. Before we get into the next subject, schools. Just real quick. Obviously, the council is watching, but it's up to the school board and Dr. Battle to try to figure this out. Money for schools. What can you tell us from your standpoint and just dealing with the schools? How are they doing? I mean, I know they just opened up, but they're all at home, and I've got this stories about the computers and the digital access. Take on in the first week since they just opened.
Well, they're working hard and they're committed, but it's not any different when World War II broke out, that there was a period of time that you just have to, it's a long shakedown cruise before you're really ready to go to Europe and fight the war. So equally in America, the COVID is so massive and so relatively quick for government that you're handling years worth of change in a few months. Now that's specifically distance learning. So now the commitment by the city to give every child a laptop, that probably should have happened a long time ago, and it was clearly going to be years that it was going to happen. So we're able to roll that out, but doing that successfully clearly is not that easy, and will just take patience and hard work. On the other side of that, then you are going to have the digital bonus for our students. When we are able to be back in the classroom, we will have advanced 4 years ahead of where we would have been in the digital space.
Okay.
Now, in the meantime, though, the school system has to run 2 parallel school systems, one virtual and one being ready to be in person. And I'm sure nothing is really harder than that. And I don't think that there's a school system in the country that has not been completely challenged in doing that. So let's just give them our encouragement. We're trying, between us and the state, there will be a significant more money invested in our schools through this cycle, through the state and the federal and metro money. They need it. They're going to need every penny of that, but just the competence in an ability and understanding of all of the challenges in the virtual space is, just think about it, overwhelming. You've got to do IT training for your staff, IT training for your teachers. You have to have a platform. You have to have a connection with your parents that you may never have had to have before in order to be successful at learning. Now, all those things in the end are a plus if we get good at delivering that. And have, again, 10 years of opportunity compressed into a few months. And so we all wring our hands a little bit, but they're working the problem, and no one has been that successful with this so far. So we should not feel that we are unique in that regard. Maybe some a little bit more successful than we are, but I think we can catch up to them in that regard.
Okay, so let's switch over and talk about so this week a lot of the discussion in the news centered around the police, everything from obviously the citation stuff going on to the chief retiring on, I guess it was Thursday or Wednesday. No, it was actually Thursday, because it was I remember that. So tell us about what's going on there. Tell us first about the chief, and then maybe go into the search, and then I'll kind of ask you some questions about the citation stuff as well.
Well, there'll be a big announcement in a couple of days by us on the search process, people involved in the search, the mission of the search process, how we revision policing for the 21st century. lot of people are going to be involved. I'm grateful to them all. This is an opportunity for Nashville to get it right and address longstanding concerns that frankly have been unaddressed for too long. Now, we will have a national search and hopefully get all this completed in the next couple of months. And then with the national search will be a separate commission process that'll end up being a mission statement, operating statement, a blueprint for the new chief, whoever he or she is, to lead the department in a really 21st century visioning of what the police force can be for our community. Now, currently in the COVID crisis, the role of the police, though mask orders is nobody's necessarily favorite form of enforcement, the reality is the mask orders are not that different than drunk driving enforcement. There was a time in America that drunk driving was not deeply enforced. And now we all realize that it's an incredible danger, and that is something that is all of our responsibilities, but also the police departments to help curb that. A bad social practice can lead to inadvertently causing the life of somebody. So they are embracing, I think that our department is embracing this evolved role for including this kind of public health in our response, the police's response of being guardians of our safety. Now, it takes a little while to understand COVID in this way, but I think society overall is beginning to understand COVID this way. And that in this time of the greatest crisis the city has ever had, really, certainly the greatest effect on our economy, on our dislocation and uncertainty, that we are again needing our community's guardians to be involved to keep us all safe. And I am so pleased at the response by the department to this new additional mission. It's, again, nobody's favorite new additional mission, but it's absolutely necessary. And I think you're going to have, I think Nashville is going to be a model in the country for how we are able to get a high level of compliance, even though we do have a kind of a tourist zone like Las Vegas or New Orleans of people coming here who don't really connect with anybody here. They may have some level of bar service, but then they go back to another community. How much does that group actually come into contact with most of the city? Maybe not much, but it's not fair either for people who have it to come and spread it to people who go somewhere else. We just may be the place where the spread happened and may not show up on our own statistics, but we should not be unfair to those other communities by dropping our guard here. Of course, we have to protect our own community first, but we have to be good stewards of the state and of the region by not allowing us to be a venue for spread.
Well, and I can add, basically, I don't think people want, first of all, I mean, we want our police doing, not necessarily spending all their time down, issuing citations and arresting people. We want people to wear masks.
They have a big other job too.
Right. So, so I think I saw where from yesterday, maybe one arrest and maybe 20 citations.
Yeah. Well, I think that's one arrest and 20 citations, but I think there's just a different level of compliance that is happening than has happened before. And I think public health is going to deeply augment the personnel in doing this. And I think we've moved beyond the phase of people going, "Oh, I didn't know," as an excuse, where I thought it was very interesting in the Tennessean today. I think there was a piece of one person saying to another, "There's no excuse for you not knowing." At this point, there is no one that does not know how they're supposed to behave in public spaces anywhere in the country, much less in Nashville, Tennessee.
Well, I will say I was on a call yesterday with, I think, 5 or 6 other representatives of big cities. And it wasn't necessarily, they weren't necessarily talking about the mask. They were actually talking about the police overall. and the concerns about, you know, what's been happening over the last several months, ever since Minneapolis. And I think the concerns that, you know, police may be reluctant, well, maybe two things: more reluctant to make stops or arrests. And here we have this COVID thing going on, and now we want people to be issued citations and so forth. So you've got that issue going on, and it's not just here in Nashville, it's across the country. They're all trying to figure this one out. And then they're also trying to deal with a major morale problem. So there were a number of questions, Mr. Mayor, that came in about this last class of recruits, and a lot of them are not from here. A lot of them are coming in from outside. And then I think the council person from Atlanta on the call was saying that they've got really top-notch folks in the police department that are just retiring and just stopping. Well, I know it's an interesting time. How are we dealing with all this stuff?
Well, it was my great honor to swear in the new class, a part of it in a socially distanced way. Brenda Haywood swore in part of them too, but to address them. It is not new that a lot of our class is not from here. That's been something that's been happening. And part of the policing commission work for the new chief is to address recruiting. And the recruiting, you not only have goals for things like diversity, you also have a very changed workforce. And I think we're part of that young people don't necessarily want a career, a lifetime career in a service like the police as much as that used to be highly sought after. Now, you get a lot of people who will like to go into policing, but they will tell you, I would like to do it for 5 years. I don't want to be a 30-year veteran. I wanted to do it for 5 years. So the proposition to our recruits ends up changing a little bit than what it used to be. It does create, I think, a cultural change as all of us adapt to a more millennial style workforce than a more traditional workforce. So the morale of our department is always a concern. I don't think it is any different here than it is in most other policing departments where morale has been viewed as not very good consistently across most cities for a long period of time. Again, this is part of, I hope, the police commission's work is to address that problem of morale. Are we not serving our officers very well? We're expecting them to serve us. Are we serving them? And how do you deal with that long term for such a valued part of our city? As I said to the recruits the other day, they are not ever going to feel as appreciated as they should be. There's probably not enough words of appreciation in a way, and anybody that's in a marriage also will realize that you can never really appreciate your all-important partner enough. And we as a city have not always appreciated our police enough. I mean, we're expecting them to show up on time in dangerous situations and for them to be the people that walk down the dark hall and to see what the problem is. That's a lot to expect out of anybody. And they have done it. And in all these discussions with COVID, consistent with, I think, our city's response to the concerns raised in late May and early June, is that they are police so valued and important. It is not appropriate to construe defund the police as in literally terminate the police department, right? They are too important. They are our guardians. What we have to do is to have them be part of our community in a better way. And hopefully that results in more job satisfaction for them and for us having a better community connection with our valued partners in doing that as well. Now, adding a little bit of public health to their otherwise overwhelming book of responsibilities, that is a pain. And I acknowledge that it's not everybody's favorite thing to do, but Nashville has never needed it more in our life as a city.
Okay. So let me ask you a couple of quick questions on this, but they're all tricky.
Okay.
People's budget.
Good.
Question came in about that.
Yeah.
I've read it online. I understand what it is. And you were mentioning that there was the argument about the funding, and the question was, what exactly does that mean? Right. I think to some extent it means looking at the way we do these things, and are the police doing? Are they doing some non-critical work that can be done by somebody else?
Yeah.
How do you refocus resources, affordable housing, and mental health issues? I know the sheriff's office is working on that. How is that coming into play? And then there's a couple of other questions as well. I'll start with that one.
Well, as I spent some time with the quite wonderful mayor of Jackson, Mississippi, who's probably the national expert for people's budgets, and you have to point out to people not from here that we have 40 council people. So you already have a lot of good popular connection from our actual process in terms of advocating for people's priorities in this budget. That's one general point, that whatever, we're just not, I mean, all of Los Angeles has 15 council people. So, we're just we probably have more people per council person than almost any major city in the country. So it is a valid process for expressing the people's desires in the budget. The thing that I hope to work with every group going forward in the next budget, this past year was kind of a crisis, and you had 10 times the adjustment, and you had $250 million worth of cuts, and you had a substantial revenue increase, is to work with this to get actually accurate information. And some of the proportionality claims that historically have been made by some people leave out things like education, right? And if in terms of our public spending, you can't really do that, because education is that much. It's not that whole part of the budget does not reach the people. In fact, the education budget does reach our people, and is all important in us having a great city going forward. But correctly engaging on kind of the true facts, so to speak, on where our spending is, I think will help have a better discussion going forward. Hopefully it will persuade some concerns, alleviate some concerns that we are not only just spending money on the police. In fact, that ends up being down the list. It's a large expenditure, on the order of $220 million, but that is, less than 10% of our overall spending. Now, can we spend it better? Can we manage better? Can we get the results that we want? Not just intention, but actual results. That's the great question that I want to work with the council in the years ahead to try to get that accomplished. Now that we have a balanced budget, we're not going to go broke. We're not going to be removed from the public markets because of insolvency type concerns. Now we can move on and manage.
Okay. All right. The second of the three questions. What can you tell me about the chief leaving or retiring? I know that he was going to leave in October, and now he's retired. What happened with all that?
Well, I mean, the chief is the Chief Anderson,
Yeah, right.
Supposed to Chief Drake. Chief Anderson, both are extremely fine people. And I want to thank Chief Anderson for making the transition so easy. And to have Chief Drake pre-positioned and ready to go. There is nothing about Chief Anderson that is not a patriot. And he is a complete patriot. And in Chief Drake, he has positioned a very, very talented and knowledgeable individual ready to lead the department right now. Now, The reality is we have a ton of challenges coming up on us right now. And in the end, waiting a couple of months um, to be prepared or to respond to those challenges is, I don't know if you ever, played football, but we've got a couple of wind sprints to do here at the end of practice. And so Chief Drake, I felt, is pre-positioned and ready to go with a level of energy and commitment that it's hard at the end of a 10 or 11-year run as chief, that we needed to stop waiting around for the new chief to happen because we have the crisis right now. Let's just go ahead and manage our way out of it. And in the meantime, I mean, it will not come to any observer of downtown City Hall. Chief Drake was always a significant internal candidate for being our new chief, and now this allows for an extra audition a period of time, and I think that's probably useful too.
All right. Last question on this subject. So there's been this recent, recent story that has been now really starting to show up about this sexual harassment, assaults going on within the police department. And I read some of it yesterday, and then I don't know a great deal about it, but it should worry all of us if it's going on, obviously. What can you tell us about that? It sounds like we're going to be investigating it. We're going to have to bring some. I don't know how we're going to do this, but you can't have sexual assaults, can't have sexual harassment in anything. Now the story's out there. What can you tell us about that?
Well, I can't really tell you anything. I've not really read anything about it other than that we will take it extremely seriously, any allegation like this. And I'm grateful to have both an internal process in the police department, and frankly, the community has a COB process to get to the bottom of any charges, particularly anything that is systematic or systemic. You've got to take very seriously and examine this, but we are not in a city that is not. We're gonna listen to and honor all complaints and allegations and take it seriously. It's our responsibility to take it seriously.
Okay. All right. Well, and I know that this is kind of a developing. In terms of the story, it's starting to rise up, and I think we all are taking this thing seriously, and we're
not everything is true, but everything deserves to be taken seriously and to get to ascertain the truth in anything like this.
Okay.
And it's of course a deep concern.
All right, so we've got less than 10 minutes left, so I'm going to switch over to what I think people are. We've been talking about for months, and now it's like we just talk about it every day, and I think people are exhausted from it. It's the pandemic, COVID-19. And I will tell you, Mr. Mayor, and we've talked about this, is that I think people are tired and exhausted, and I worry that, I think people thought there might be some reprieve, and they certainly came out at the beginning of the summer, and then the numbers went back up. And I think people are really, frustrated and tired. From the city standpoint, what can you tell us overall? How are we doing? And is there some light that we can see at the end of the tunnel where we can maybe feel a little bit better about where we are?
Short of a vaccine, I do think there is encouraging general news, by the way, about having a vaccine on a much different schedule than any before in history. Well, I agree with everybody about being worn out, and nobody will look back on this year as a happy year or a happy experience. I said in the press conference the other day, and for those who may have missed it, I think it is important metric for people to understand this 10 cases per 100,000 per day. So that's about 70 cases in Nashville. Above that level, you're clearly at kind of a nationally recognized red zone without a lot of national leadership, frankly, on the disease. Cities and states, including our own state, has recognized that 10 per 100,000 per day is a metric to pay a lot of attention to. We have just now gotten back down to 25, so 2.5 times this kind of red zone metric. We had been as high as 65 or 70. A lot of places in the Sun Belt did have this quick and deadly spike in the disease starting in late June and early July. Now, I do think what's happened is that all of the things that we have been doing here and other places would validate that has been working. It's just that it works slowly and that it takes some cycles of the disease to begin to push that down. Now, I am a little bit concerned that we are plateauing a little bit in our reduction of the spike. But if we could get from 25 down to 10, I think that gives a dramatically different disease platform. The other thing that we have learned is how easily it can come back. I mean, Dr. Hildreth warned us all about this in the beginning as one of the great infectious disease experts in the country, that you can't get it to zero and it can flare up at any time, and you have to have habits, wearing a mask and social distancing, and avoiding the super spreading events. That it's the super spreading events that somehow just blows up the disease in a hurry, and being overly and being extremely concerned about the super spreading environment and super spreading events is quite appropriate for the public health department.
All right, so let me ask you about, you were talking about different numbers. We all use different numbers. I worry about the capacity of the hospitals and ICU bed. How are we doing on that one?
Well, it's, of all the numbers in this, that's probably the hardest to read. The reality, and I think the mayor of Memphis would agree with me on this. Here's several things to keep in mind. Hospitals do tend to have a lot of capacity if they are given the time to stop elective surgery. And when things get critical, they need some days or weeks to clear out a lot of additional capacity. And then they are willing to do that. Now, for them to have that unused capacity causes them to lose a ton of money. So we don't really want them to lose a ton of money because we need them to be financially healthy to look after us. But at the same time, we want capacity there that if there's a spike, that you can fill up those, you can serve people who are infected. Now, you can say, gee, the city needs to go add hospital beds. If you get down to between 10 and 20%, shouldn't you be adding hospital beds? Yeah, and yes, and Nashville General has added a lot of beds to additional capacity in the city. The problem is staffing. Is at what point a lot of our surplus staffing that was available, particularly in a healthcare capital like Middle Tennessee, has gone to other markets to help with their COVID response there. And so if the thing to worry about is not hospital bedding and beds and capacity, it is what is our staffing resources available to handle cases that might spike up. It's not the physical bed anymore, it's the number of nurses involved. And so if you read through the ICU and bed capacity numbers, you need to read through to see what are the staffing plans for the emergency centers. Now, everybody's working on it. But yes, as I say twice a week anyway, it's a caution, but it's something that Dr. Jahanger, I know, has been working extremely closely with the state for several months now. And the state itself is very aware of this. And it's a constraint that other places for sure have as well.
Okay. So we only have like 2 minutes. I'm gonna ask you real quick one last question on all this,
Okay.
and then we'll end this thing. The homelessness, something that we've talked about, and I give your office and credit to social services and Judy Tackett, because we had a meeting this week to talk about the winter plan, because this is going to be really, really difficult for several different reasons. Most of the time we try to figure out a way to deal with the homeless population when it gets really cold, 28 degrees, and we try to figure out ways to bring them in. But usually our initial resources are like room in the inn and the mission, and they're in a difficult situation because they are limited in capacity. So there has been discussions already. It started to figure out what are we going to do. Usually we have these conversations in November. We're doing it in August, which is very good, and I appreciate that. Any word on that? I know you've got folks working on it. Anything else that you can tell us about that?
Well, I think there are two aspects of it. It's a big challenge. It's one of these post-COVID adjustments that we don't quite know about. Does our long-term homelessness crisis go up because of COVID, after COVID? You have to assume that it does. You have to be prepared for it. So you have this year plan of dealing with the crisis and the problem. And again, working with you and the council and the Metro Commission, we need to roll that out and get that done appropriately. I think where we have provided help for the unsheltered, such as at the fairgrounds, I want to say it's a great success story how little disease outbreak has happened there at the fairgrounds. I think it's been very professionally run, and compared to other efforts in other cities, that we need to view that as a success, as I'm told. The other part of this long term is I want to use the crisis as an opportunity to build a much bigger strategic plan to address this crisis overall in terms of long-term supportive housing and our goals in that area. That takes a little bit of time to get this in place. I think there are some COVID resources that is available to do that. And again, I think it would be very exciting as we vision the city going forward to actually really address the problem for the magnitude of need that exists. And historically, this has kind of been, I think, people have been aware that it's a growing crisis, but let's go ahead and put it front of mind and realize that it's going to take real resources to address a long-term supportive housing strategy. And I'm hoping that in the next few weeks, we will be putting that forward.
Right. Mr. Mayor, it's just after 11. We appreciate the time. Thank you for spending an hour with us today.
Well, thank you, Vice Mayor. It's a great privilege. Thank everybody for being here. I'm going to leave and go have some meetings with our hospitality industry that always has a lot of profound opinions that they want to share with me. So if I'm lingering here on this call, you see there's a reason.
Okay, I'm sure that it'll be an interesting set of meetings. No, we do appreciate the time. It's been an interesting first year of office, and
2 more months. Well, almost 2 more months. Well, thank you, and thank you for having me, and to everybody who took the hour out of their Saturday morning to listen.
All right. Everybody stay safe. We'll be back on next week. We have Captain Blair, Greg Blair, from the police department, who is in charge of training. So that should be interesting as well. Everybody stay safe and have a good rest of your weekend. Thanks, everybody.